So hepatitis B is also a blood-borne illness. So it's a disease that is spread through blood, and it's part of what we call the Hepatoviridea family. You'll see a lot of viruses come from a family, just like us. Then you'll have different relatives. So different cousins will cause different issues.
Right.
So the three big hepatitis that we worry about is hepatitis A, but that's something you get from food and water. And then B and C are the ones that get transmitted in blood. Now, the reason we say hepatitis B is a silent burden, like when we talked about Ebola, I was saying that Ebola is a disease of caring, meaning if you're sick and I look after you, I pick up the infection. I usually think hepatitis B is a disease of by the way.
By the way.
Meaning nobody is actively doing tests for hepatitis B. You see, we have the VCTs, we have so many drives for diabetes, hypertension.
Yeah.
But I'll ask you, have you ever heard of a hepatitis B drive? No.
Never heard of it.
So that's why it's the by the way disease, meaning if you are a pregnant woman and you're going in for your antenatal profile, they'll be doing those tests. So they'll do HIV, hepatitis B, other things, and they find, oh, it's positive. If you're going to see the nephrologist because you've got kidney failure and they need to dialyze you, he'll do the hepatitis B test. If you're seeing the rheumatologist or the oncologist and they want to do cancer treatment, then they'll do the test. So it becomes, so you came in with this issue and, oh, by the way, we happen to pick up hepatitis B. So in a country like Kenya, you'll say our prevalence is like 5 to 8%, which doesn't sound big to people, but in medicine, even 1% is huge. So you've got about 800,000 to 1 million people who have hepatitis B. That means those are the people we know. So how many people don't we know? So hepatitis B is this virus, gets into your bloodstream, and by definition, hepatitis just means inflammation of the liver. So it gets into your bloodstream, gets into the liver, and attacks the liver. So usually when you get into contact with an infection, and we said it's bloodborne, so that means it can be sexually transmitted, can be transmitted from mother to child, it can be transmitted from IV drug users who are sharing needles, but it can be from even you, again, looking after someone who's very sick and has it in their sweat and their secretions. Now your body is primed to do things. Your body is primed by nature to fight off an infection. Most of us maybe even picked up hepatitis B and didn't notice, because your immunity did what it needed to do. So that, so that's the acute phase. So you fall sick and you find you have general symptoms. So you'll have fever, you'll have headache, you'll have malaise. The things that will make you think that this is attacking your liver is, one, you'll start to see your eyes go yellow, which is what we call jaundice. And then you'll see changes in your urine and your stool, meaning your urine becomes very dark and your stool is becoming pale. Because the liver is the one that produces these waste products to color these excretions. So when you get an attack there, you're building up waste products, which is why you're seeing it in your eyes, and you're getting a shift as to how it's being removed from your body. So usually that's the first sign to let you know something's happening in the liver.
What about